Ready? Okay. Good afternoon, everybody. Rich Fitzgerald, County Executive here with Dr. Deborah Bogan, Allegheny County Health Department Director, for our weekly update on the coronavirus pandemic. The big news this week is one of the big news. There's a lot of big news, but one of them on the pandemic is Allegheny County and most of southwestern Pennsylvania will be going into the green phase on Friday. So again, a lot of this from the governor and the Secretary of Health, because of the numbers continue to remain low and continue to remain low when we were in the yellow phase. During the yellow phase a few weeks ago, offices were able to open up again, as well as retail with limitations, with some of the mask and physical distancing and hand washing and surface, et cetera, that we all have been learning about over these last few months. In the green phase, starting on Friday, we know that restaurants open up again at half capacity of what they typically have. We know that nail salons, hair salons, gyms will be opening up again. Again, with limitations, appointments need to be made, things along those lines, and every business has been preparing for this for at least this week and probably a little bit beyond that. Visitations at hospitals, again, under limitations, will also occur. And a few other things. So I just think as we move into the green phase, it's certainly an opportunity for us to open up our economy, but it also brings with it potential risk. And obviously the other big news of this week is the protest that has occurred due to the murder of George Floyd in Minnesota, a tragedy that has just torn this country apart, and on a personal level is gut-wrenching. To watch that and to see the history and know the history of what has gone on in this country when it comes to institutional racism and things that have occurred at the hands of law enforcement over the years has led this country into, obviously, a lot of turmoil. And for lots of reasons, the protests cause other challenges. And I certainly support the protesters and support their right and our right to speak out and for redress of things that we just don't think are right. And this hasn't been right for many, many years. We've seen it certainly in our community with Antoine Rose and some other situations that have occurred. So we certainly support our fellow citizens' right to get out and redress to the policymakers at all levels, things that need to be corrected. But again, as for our standpoint that we're talking about now, we still want to make sure that we keep social distancing and physical distancing, and we know that's a challenge. People wearing their masks, and as we watch some of the protests that have gone on over the last few days, it appears to me that the vast majority of people are wearing their masks and doing these type of things. So we want people to be safe for all reasons, and certainly the virus has not gone away. We have not developed a vaccine and or a cure at this point, so we really want people to make sure they remain safe. And again, as we go into the green phase, we still want people to try to work remotely if they can, work at home, physical distancing, because we know wearing a mask, keeping physical distance, and being not in an enclosed space with a lot of people is your best chance to avoid getting infected by the virus. So we certainly, again, want to make sure people are doing that. We also know that with the potential of so many people coming together at some of the demonstrations, also the election yesterday, we had over 100,000 people who showed up to vote. We're glad people participate in the democratic process. We also appreciate the fact that well over 200,000 people participated in the democratic process by mail, keeping themselves safe. Not only themselves, but those poll workers who come out and do such a great job and serve us as citizens. Over 2,000 of those who worked all day yesterday, long hours in a warm environment. We also know that we're going to be taking a look in the county at some of our pools to see if we can open those. The county manager has already begun advertising to try to see if we can get the lifeguards. We typically need about 150 lifeguards in the summer to staff the 4 pools that we have in Allegheny County. To this point, we have not seen a lot of folks come forward, but we hope that will happen as well. And then one other thing, we've been talking about this that's really important, and certainly in light of some of the things we've seen this week, is the census. Again, if we can do this online, if we could do this by mail, rather than have people have to go in person with the potential for contact, again, keeps people safe, and it's just one more function that we can do and still be productive in how we do it, but do it remotely and keeping people safe. So with that, that's just a little bit of a summary. We'll certainly come back and answer some questions, but I want to turn this over now to Dr. Bogan to make a few remarks. Dr. Bogan?
Thanks, Rich. So this has been a challenging week across our country and right here in our county. I hear and feel the pain of the protesters, and especially those from our Black and brown communities. I hear and feel this pain as the head of the Allegheny County Health Department, where we are addressing racism as a public health crisis. As a pediatrician who for decades has cared for this county's youngest, and as a neighbor who loves this community, believes in it, and has seen the good that can come when we respect one another. Like many of you, I watched the murder of George Floyd at the knee of a police officer last week, and my emotions have gone from anger to sadness to frustration. I will use my voice as the director of the health department, a pediatrician, your neighbor, to stand with you to address health inequities in our community. Health equity is a priority of the health department, and by addressing it, we can make Allegheny County a healthier place. During the COVID-19 pandemic, the health department is working to make equity a part of our response. The work has included hosting listening sessions with the faith, immigrant, refugee, LGBTQA, Black, and Latinx communities. Working closely with the federally qualified health centers to expand testing. And we hope to release very soon more complete data on race and ethnicity and a deeper analysis of how the virus is affecting the communities of color. Across the US and Allegheny County, COVID-19 has disproportionately impacted communities of color, including startling higher rates of hospitalizations and deaths among Black women and Black men. We will continue to work with community partners to improve communication to communities of color on how to stay safe. As Rich said, this Friday, Allegheny County will move into the green phase of Governor Wolf's reopening plan. I know this is welcome news for owners and patrons of restaurants, hair salons, and small businesses, and many of you. We are undoubtedly going green because of the choices and decisions each one of you made to continue to stay home, to only go out for essentials, to practice social distancing, to avoid large groups, and washing your hands and wearing your masks during the yellow phase. As we move into the green phase, the health department is ready to respond if needed. We've helped expand testing in the county, and I'm happy to announce that our federally qualified health centers and community clinics have tested about 800 people, and less than 3% of those tests have come back positive. The county's team of case investigators and contact tracers have been able to keep up with the number of new cases during the yellow phase. We currently have in the health department 10 people conducting case investigations 7 days a week. The contact tracing team is currently composed of 2 full-time contact tracers, 4 medical student volunteers, 8 medical reserve corps volunteers. And the health department is in the process of hiring an additional case investigators, contact tracers, and epidemiologists. The health department's contact tracing team started to use Sarah Alerts on June 1st. And on June 8th, we're pleased that Sarah Alerts will start offering notifications in Spanish as well. Some of the data from the weeks after we entered the yellow phase is still preliminary, but we do not see a significant increase in the cases, hospitalizations, or deaths during this time. From May 1st to May 15th, the 2 weeks prior to going into the yellow phase, there were 235 new cases, a positivity rate of 3.6%, 55 hospitalizations, and 42 deaths. In contrast, between May 16th and May 30th, the 2 weeks after going yellow, preliminary data show that there were 229 cases, a positivity rate of 3.1%, 48 hospitalizations, and 8 deaths. The data for the last few days of May is not yet complete, and these numbers could change. And we also know that there are perhaps hundreds of negative tests that have not yet been entered into the NED system, and those will increase our testing numbers and decrease our positivity rate. We know the virus is still present in our communities, but the data show we are all taking steps to keep ourselves safe and to decrease that rate. So these steps need to continue during the green phase. Please remember that if you are not feeling well, please stay home. If you can work from home, please continue to do so. However, whether you are going out to the store or going to stand among your community in civil protest, please remember that we protect one another by wearing our masks, using hand sanitizer or washing your hands frequently, physically distancing from one another by at least 6 feet. And for an added level of protection when in a crowd, please consider wearing an eye covering such as goggles, glasses, or a face shield. Thank you all for your time. Please be safe and be kind.
There are a number of questions that are duplicative. There's also a few questions in this list that you have already answered in your comments. So for members of the media who are on the call, if you feel that they weren't addressed appropriately, please do follow up with us. The first question is from both WPXI and WESA. They're asking about whether you have concerns with the spread of COVID-related disease due to the protests, and then specifically to just Dr. Bogan as well. Is the Health Department preparing for a possible jump in cases, and if there are any steps being taken for contact tracing related to that?
That's always a concern. Anytime you have a mass gathering of folks coming together in a very closed environment, that's certainly a concern. But again, the one thing I've seen, again, visually, and this is anecdotally, is that most of the folks that we see are wearing their masks, are trying to somewhat become as distant as they can. It's very difficult, obviously, when you have those type of crowds. But I think, as Dr. Bogan has said, the folks in this community have continued to very responsibly wear their masks, keep distance, to protect their neighbors, to protect their friends. The folks that are coming to the protests and demonstrating are doing so for good reasons. They care about their community. They want their community to improve. And so they're there to protect their community and improve things along the public safety and police accountability aspect. They also care about their neighbors as they come through this process. As Dr. Bogan said, the reason we're going into green and other areas haven't is because the folks here have been so responsible in their actions, both at work, socially, in their private lives with their families, and even again yesterday in the election process, people were wearing their masks, people were being very responsible, practicing the democratic process, but doing so in a safe and responsible manner. So we want to continue that because, as Dr. Bogan said, the virus has not gone away. It is still here, and we need to make sure we keep people as safe as we can.
And that question for Dr. Bogan again was whether the health department is preparing for a possible jump in cases due to the protests, and if so, what steps are being taken for contact tracing.
So we've been preparing for a rise knowing that we are going green. We haven't really changed those plans. We have a lot of ability to increase the numbers of case investigators and contact traces to address any rise that we see. And so we're not making any specific changes as a result of the protests.
The next question is for Dr. Bogan, and you referenced a few of these pieces in your response, but this is from WESA. Are we poised to move into the green phase on Friday? Is there quantifiable evidence that the yellow phase has been successful? And in terms of continuing to keep case numbers low, what specific data points are you looking at?
So I did go through some of that, and I gave the numbers in my remarks. So we have looked at the numbers of new cases, ensuring that our positivity rate is not increasing. We're looking at hospitalizations, we're looking at deaths, we're looking at availability of bed spaces over time, and we are doing, in all respects, we're doing very well.
These next These next few questions are also for you, Dr. Bogan. From the Post-Gazette, could you please tell us more about the clusters that the county's contact tracing teams have identified? Were they clusters from some specific gathering, from some people who worked in essential businesses? Any specific examples that you might be able to provide about what the clusters in our county were?
Yes, so there have really been very small clusters lately. They're mostly family related. Again, 3 or 4 people. We have seen some workplace clusters like we saw in the Port Authority West Mifflin Garage and long-term care facilities. But really that has been the bulk of our clusters. And again, lately they've been very small and really related to families and households.
This question also from the Post-Gazette. Would it be a regular part of a contact tracing team's questions to ask if a person who tested positive was at a large event like one of the rallies this past week? And if so, do you expect to be able to say in the next week or two with any certainty whether the protest rallies became large spreader events?
So the case investigators will ask about people's close contacts, and they basically use a timeline where they'll ask in the last, starting about 48 hours before symptom onset or the test results, have you had any close contacts? And they march through each one of those contacts and ask. So if somebody says, I've been to a rally, they would know that they've been to a protest or a rally. There is a new question that was added to the NEDS questions recently that asks about, have you been to large gatherings? That's sort of a yes-no question. And if they say yes, there's an opportunity for the investigator to enter free text about that. So we will be able to tell if people, and that is in preparation. Didn't get in there because of protests. It was added because people are going to the green phase, and we know that there'll be larger crowds at places. And so it's really to be able to track what happens as we enter green as people get together in larger groups.
The next 2 questions are regarding Kane. The first one is, if you have not already, could you provide an update on the Kane homes? And related, are all Kane employees provided with PPEs? Community organizers last month said they were told that PPEs are only available upon request.
My understanding is that the Kane employees do get PPEs at all 4 of our Kane facilities. And I know the Kane website updates, I believe, every day. Some of the information. If I have these numbers right, I hope I do, but it's Scott. I believe they tested 263 of the residents, and 263 residents came back negative. I believe in McKeesport it was 281, and 280 came back negative. And Ross, I believe it was 178 and 175 came back negative, and they had been doing the testing at the Glen Hazel facility. And I believe to my understanding, there's no active cases at this point. But that information is updated daily on the website, and it's probably even a better way to stay informed on a regular basis.
This next question is for Dr. Bogan from WESA. Dr. Bogan, if you've attended a protest recently, would you recommend getting a COVID-19 test?
Oops. Sorry. If you're attending a protest and you're concerned that you might have been exposed to COVID-19, I think it's perfectly fine to go get a test. I would encourage people to wait about 4 to 5 days from the possible exposure. Again, the average onset of symptoms after exposure is about 5 days. I'm worried if you go too soon, your test will be more likely to be a false negative. But again, we have lots of testing capacity in the region, and if you're concerned, I would support your decision to go get a test.
This next question is also from WSA. Police in Pittsburgh have deployed rubber bullets against protesters in recent days. A 2017 study found that rubber bullets kill 3% of the people they hit. Because these bullets are intended to be less lethal, but in fact can be deadly, should they be banned?
I'm going to leave this to the public safety professionals dealing with ways in which they deal with issues like this. We follow, again, just like we do here with Dr. Bogan and her team on medical expertise. I'm sure whether it's the city of Pittsburgh or whether it's the state police or whether other law enforcement entities would be relying on the best information and the best techniques that they can deal with. These are some of the decisions and some of the conversations, though, I think we will be having in the coming days that our legislators at the state and federal level, as they're wrestling with some of the practices that occur. Are there better ways to do things? Are there better ways to deal in public safety? Obviously, there have been things, as we talked about, in the tragedy and the murder at the hands of the murder of Mr. Floyd at the hands of the police officers in Minneapolis was not just an isolated event. We've seen this throughout our history with institutional racism in our country. So these things, need to continue to be looked at, and I'm sure our legislators as well as our public safety officials will certainly evaluate that.
This final question is for Dr. Bogan. This is also from WESA. Yesterday, the county's dashboard showed 36,000 total tests, but today it appears as if that number is 34,000. Can you explain the difference?
Yes, and we can provide more details after the call. There was a change in the coding of how the data were pulled from NEDS, or the NEDS coding, and the extra 2,000 came from positive results from antibody testing, and we had previously had a way of pulling that data out, and because of the change in coding, it resulted in 2,000 of those, approximately 2,000 of those antibody tests appearing in our dashboard for a couple of days. So we've removed those, and again, we can provide a more detailed technical response to that if people are interested.
Thank you. That is the final question. If either of you have final comments.
Again, as Dr. Bogan and her team have talked about, moving into the green phase is certainly an opportunity for so many of our businesses and workers who have been out of work in those areas we talked about: restaurants, hair salons, nail salons, gyms, etc. And we want to continue to have people get back to work, get back to as normal of an existence as all of us have missed over these last few months. So continuing to act responsibly, continuing to wear our masks, do the physical distancing, do as much of our activities remotely, online, over telephone, etc., that we can do, but still be productive in our lives. So again, we want to thank our healthcare professionals, our first responders, obviously our police officers who are out there protecting us in so many different ways. They've continued to work and keep us safe, and we thank them for all the work that they've done. So let's continue to stay safe, continue to do the things